So hello and welcome to tonight's Discover Seattle Colleges. My name is Lyds Adira, and tonight in this breakout room, we are going to discuss two bachelor programs of applied science. And the first one is Community Health and Education, and then also the Healthcare Services and Management program. So one of the main questions that I get is, how do I get to a bachelor program? Because many four-year universities don't really break it down. Now, we talked about how most of the students who come to Central are usually in high school or right after high school. From there, you can get your certificates or your associate's degrees. And it's around that time that you can start looking at these BAS degrees. The reason for that is because for the BAS degrees, you need to be pretty close to having an associate's degree and having a displayed history of interest in healthcare. So you can do that in working in clinics or having a certificate in healthcare or working in other healthcare settings, or just a general interest and have taken a bunch of healthcare classes. So the Bachelor of Applied Science is a little bit different than most undergrad programs just because it has that applied part of it. The idea between these programs is that our students gain the confidence so that when they're in these professional settings, they have those critical thinking skills and are able to act autonomously. You get to learn to work with both people and data. And what I like about this is that it holds the accountability of equity practices and gives people the chance to check their work and continuously improve what they're doing. The bachelor classes are a little bit different than some of your lower division classes just because they do focus on research and writing skills and professional skills. These programs are designed for students who want to go out and work in a certain career field or occupation that interests them in healthcare. What's nice about our classes here at Central is if you're already a student at Central, you get to take your classes and just keep taking classes. It's a great value, and I'll go over that a little bit more later. If you're a state employee, you can use your waiver, or in many job training opportunities are available as well. The way Central is centrally located in Seattle, we have a very diverse student population, and our class sizes remain pretty small, maxing out at about 30 students. So the bachelor programs are sister programs. They're meant to be compatible if you have interest in both the community side of healthcare and the administrative side of healthcare, so that if you wanted to take these programs together, you could. So for the community health and education, we're educating our students about specific communities, groups, wellness topics, disease prevention, which is so applicable right now to the world we live in. So if you have an interest in public health, or even we have a pre-PA track that's available, and I'll talk more about that. And then for the healthcare services management, like I said, this is the administrative side. So this is for people who are actively working in healthcare and they're kind of ready to go out for that next promotion, and they want to bolster their managerial skills a little bit. So what a bachelor degree looks like is 60 degrees of your general education. The core curriculum for each program is 45 credits. And then you would need another 75 credits of related electives. An associate's degree is approximately 90 credits. So you're halfway there once you get to an associate's degree. Now, if you decided to be a student who took both HSM and CHED classes, you would only have to take 80 credits of core curriculum and then only 40 credits of related electives. So that's how that balances out. It's just a little bit different. Now, the entrance requirements are an associate's degree or very, very close with a 2.5 GPA, cumulative GPA. You need to have at least a 2.0 in English 101, a 2.0 in Math 146, which is statistics. Now, if you're very close to completing an associate's degree, don't wait. Definitely reach out, and I will have my email at the end for us. So some potential careers for these programs, for that CHED program, it has that education part of it. So you will be certified to take what's called the CHES exam, CHES, and that is the Community Health Education Specialist exam. It also, I just found out, gives you the option to become a life coach if you want it. So you could become a health educator, a life coach, and then you will have all of the classes. If you want to take the PA class, the PA track, you can go on to PA school, and you could go on to grad school with either of these programs. So the difference between the general CHED track and the pre-PA CHED track is pretty slight. You just have to get slightly a different GPA. So for the regular CHED class, the bachelor classes, you're looking for at least a 2.5, and for any of your other electives or requirements, a 2.0. For the pre-PA track, we go based off of the MEDEX standards through UW, which is a minimum GPA of 2.7, and you need to have an overall GPA of at least 3.0. And then rather than some of your general electives, you need to take these other advanced science classes. So that's what this looks like. So for the regular track, the HSM or the dual, this is what that looks like. This is your general education. That's that 60 credits that we need to get you in the door. And then for the pre-PA track, these again are the minimum requirements based on the MEDEX standards. So you need a 2.7 in some of those classes. And then you need at least one chemistry class. This is where it gets different. The one chemistry class, biology 160 or 211, these are your general biology classes. 241 and 242, those are A&P 1 and 2, anatomy, physiology 1 and 2. And then biology 260 is microbiology. So the core curriculum is next. There's 45 credits per program. And like I said, they're sibling programs, so they're made to be kind of workable together. So we offer 2 classes that are taken by both programs. So these are your information literacy and health sciences and your research of allied health. So this is the core information. We want you to feel confident in the research you're doing, the work you're putting out, and know how to find something in a system if you haven't been given the information quite yet. So that is the curriculum. Oops, sorry. Oh, no. There we go. So this is the core curriculum. And then down here at the bottom, you can see both programs complete a capstone project. So that is HSM or CHED 476, 477, and 478. It's a 1 credit, 1 credit, and 3 credit class that you put together your final project in. So the capstone project is the culmination of the student learning throughout the project. Students take on the project using their faculty of either the CHED or the HSM program, which can serve as a community mentor along with some experiential learning, whether through research or their current job, volunteer hours, or service learning through the Seattle College's Resource Center. It consists of a final presentation and paper that's developed over 3 quarters and presented in the spring quarter after all of your other classes are done. So this is what the overarching classes look like. We offer all of our classes once a year, so it is important to be working closely with an advisor, which is me, and making sure that we keep you on track because, like I said, these classes are only offered once a year. So in fall, which is when the classes generally start, but we do accept students on a rolling basis. So we accept all quarters. fall, winter, spring. For summer, we accept for fall. But this is what it would look like. So in fall, you're learning your foundational information, your principles of community health or your principles of healthcare services management. You're learning about accounting, building blocks for healthcare management for the HSM program, learning about that information literacy, and you'll be working with HSMs or CHED students in the opposite program in that information literacy class. So that's kind of nice, a crossover. Then in winter, there's the piggybacked class of 401, Principles of Research. So that 330 class in the fall is the foundational information class, learning how to navigate databases, learning how to gain information, how to find reliable sources. And then in the winter, when you take the 401 Principles of Research, you're learning how to present the information that you've collected. So that's for both programs. And like I said, the community health and education program is the community focused part of healthcare, and the HSM healthcare services management program is focused on the administrative side. So you're getting more leadership and administrative lessons versus the community health and education is about program planning, development, how it impacts the community and the individuals. Now, if you wanted to take both degrees, if you wanted to learn about both the community side and the administrative side, this is what it would look like. So you would just have to take your research classes once, and then you could take all of the other classes and the capstone concurrently at the same time and just put together one capstone. There's also only the 40 credits of electives rather than the 75 credits of electives. So you're not having to spend any more time than other students. It's just a matter of where your credits would fall. If you have 75 credits already, you know, maybe you wouldn't want to take this track. So we all want to know how much it's going to cost us. Now, we do have lots of financial aid options and opportunities at Central, and this is just about the average. So there was that that number on the previous slide, the 7,599, I think is what it was. But it's that's the average. And then this is what it would look like for just one credit. And if you do the math, if you take 15 credits at one time, it ends up being less per credit. So if you take 15 credits, it might be a little bit less than if you just say take 5 credits at a time. And then these course related fees are pretty standard. Some of them are one-time fees, but it does end up being under $10,000 to attend generally, which is really good. And Central, as a community college, prides itself on providing the lowest possible tuition possible. So that is the end of my formal presentation. So I'm going to open up the floor for some questions. Some of our main questions that we get are there multiple paths to get into this program? Of course, yes. People would like to know if they can go to other schools after they've graduated from these programs. Yes, we are accredited. And yes, you can get into grad school when you've graduated. And here is my email if you would like to make an appointment with me. And I am now going to open the floor